All right, I'm going to share my screen. Hey, welcome everybody. My name is Rob Humbracht. I have been working closely with Christina for several years now. I'm down here in my home office in San Diego, California, and I am here on behalf of a couple of different entities. Let me go ahead and hit present here. So the first one that I want to tell you about is an opportunity called the HEAL Clinical Education Network. So I've been helping people get into med school and other graduate schools for about 20 years. I started as an MCAT instructor, and I kept getting the same question from students over the years, which is, I don't even know how to get started in getting clinical experience, or it's not allowed for freshmen, or I don't have a car, or whatever. I'm stuck at home because of COVID. And so I founded the HEAL Clinical Education Network with a longtime colleague of mine, Janet Snoyer, to try to help our students get high quality virtual clinical experience. So just a quick background. So I started a company 15 years ago that helped students one-on-one with their med school applications. Everything from figuring out where to apply to helping them with their essays and interviews and all that stuff. So that's one bit of knowledge that I have here. If you guys have any admissions related questions, drop them in the Q&A. If we have time at the end, I'd be happy to answer them. The second is I'm the founder of the HEAL Clinical Education Network. And then at HEAL, we use this tool that is HIPAA certified patient-doctor interactions. And that tool is called RealDX. And so I believe so much in RealDX that I have become their CEO as well. So I'm here representing 3 different companies. As you can tell, I'm very passionate about clinical education. And I think that virtual clinical education is a great option for so many people today. So when I say the HEAL team, there's a bunch of different people at HEAL. We have interns, summer interns, fall interns, winter interns. It's a great way to help contribute to HEAL, to build your skills in a variety of areas, to get a lot of additional clinical content. We have preceptors. Preceptors are the medical professionals that guide our students through these real patient-doctor interactions. And then finally, there's a small team at HEAL helping to run the thing. So that's who HEAL is. I briefly wanted to explain what I see as the primary purpose of virtual shadowing. So virtual shadowing is pretty new. It only really started about a year ago. And people are wondering, hey, is this a worthwhile experience? Well, let me point out the limits of traditional shadowing. So traditional shadowing, first off, there's limitations in terms of opportunities. Either you're located close to a hospital that allows traditional shadowing, or you're not. Less of a problem when you're in LA than in rural America or an underserved community, but still a limitation. The second is what we call social capital. If you know a doctor, it's really easy to get shadowing. And if you don't, it's not as easy. So if we're talking about some of the disparities in medical education, this is one of the primary drivers of that, this requirement to be in person when it's not easy to find. The second would be engagement. Most shadowing, you're off in the corner, you're trying to observe what's going on, but the doctor has other things to attend to rather than just explain to you what's going on. The final one is you don't typically get much feedback on your shadowing. And so these are something else that virtual shadowing can help overcome. Then the final thing would be about the experience. Traditionally, you only shadow one experience, one specialty at a time. And finally, there's hidden costs to traditional shadowing. You got to pay for parking or bus fare or whatever. You have to have professional attire. You have to pay for hospital food, all that stuff. So into this world steps the HEAL Clinical Education Network, trying to base our shadowing on what admissions committees are looking for from shadowing. So I've talked to many, many, many admissions officers. I've worked with many admissions officers over the years. And typically they say they want 3 primary things from your clinical experience. First, they want to know whether it's interactive. Just passively watching doesn't help anyone. But if you're actually engaging with the content, it all of a sudden changes the nature of the experience for you, and it really helps connect with why you want to be a healthcare provider. The second is they ask, was it memorable? One way to think about this is, will you have anything to say in your essays when you're applying? If you don't, it's not really helping you get in. And then finally is, how do you grow over time? Do you actually build skill as you go? Do you actually gain additional knowledge? So all of these things are what we're trying to do at HEAL. And so we base that off of these real patient cases. And so I want to give you an example of the difference between just, say, generic, dry textbook learning and what it feels like to actually watch these videos. So this is a definition of a term called marasmus. And so marasmus, and again, I am not a healthcare provider, so forgive me if I botch any of this, but marasmus is a form of severe malnutrition characterized by energy deficiency. It can occur in anyone with severe malnutrition, but usually occurs in children. Body weight is reduced to less than 62% of the normal expected body weight for the age. Marasmus is commonly represented by a shrunken, wasted appearance, loss of muscle mass, and subcutaneous fat mass. Buttocks and upper limb muscle groups are usually more affected than others. So this is what you might see in a textbook. Is it memorable? Like, you may now know what marasmus looks like or what the definition is, but I'm pretty sure you guys are going to forget as soon as this presentation is over. So let's see what that then looks like on video. And so just a word of warning, the following video is not for the faint of heart. But you guys are going to be future medical providers, so I'm assuming you'll be able to handle this. All right, can you guys see case 469, vomiting and severe malnutrition? Would somebody say in the chat, like, yes?
This is a two-month-old baby who weighs 2.5 kilos, 6 baby for the mom, and a history of not feeding well, vomiting, no stools for a week, and obviously is severely malnourished, has rachitic rosary, has some skin changes consistent with pellagra and vitamin deficiency state. So the baby...
So this is what a video case really looks like. Are you going to be able to see this in most shadowing experiences? Probably not. You know, what's cool about it too is not only do you see the video, but you can actually get all of the background on the patient. You can see the vitals and demographics. You can see the differential diagnosis. You can see the outcomes, the treatment. There's some follow-up. There's some porting materials about the different conditions that you're seeing. There's just very little way to replicate this in a live setting where you got to get permission to see most things. So this is the role that I think HEAL can play in your journey. And so it really is a journey. So, you know, as you go through HEAL, we have a couple of different options for you guys, and you're cordially invited to attend any of these. The first is what's called HEAL 101. It's every Wednesdays at 5 o'clock Pacific, and we go through a different case each Wednesday. So if you're interested in what I showed you tonight, wait till you see what it looks like when led by a doctor. The second would be we have a bunch of what we call anytime courses, asynchronous content. You can learn about any possible specialty through HEAL. So we have something like 38 different courses on different parts of medicine. But combining that, we have these things called intensives. And so intensives are where you focus on one particular component of medicine, and you learn and grow so that you can actually present the content. So for example, our fall intensive is twice a week. You learn about different parts of medicine. I think it's surgery and neurology and something else that I'm unfortunately forgetting. And it's a small group. It's only 8 to 10 of you. You meet by Zoom. You build your knowledge. You learn, you shadow a doctor directly, and then you really get to grow in the way that you have understand the material. To the point where our students themselves will actually present the material back to each other in a problem-based learning format, which is exactly the style of learning that most med schools use these days. So you guys are cordially invited. I'm going to put this link in the chat. And again, if you don't want to hear from us, then don't fill this out. But here's the link. If you guys would like to have a free advising session with Passport Admissions, check this top box. We have a limited number of these, so we wouldn't be able to work in all 40 of you guys. But if you would like to see, if you're thinking, oh, I might need some help on the path to med school, check that top box and we'll reach out and send you a link to our schedule, and you can book a meeting. If you're lucky, you'll get a session with me. No, just kidding. You might. But then the second one is if you would like to attend a free shadowing session through the HEAL Clinical Education Network, fill that out. Again, we'll be in touch with the link and how to do that. Everything at HEAL is at clinicalshadowing.com. You can enroll in our October 101 class. We had our first session last night. You can look at our other classes if you just go to our courses. There's a bunch of different options there, but that's for another time. And so I believe I wanted to save the rest of my time for any questions that you guys have.
There is a question in the Q&A.
Perfect, I see it. So what would interactive shadowing look like? So my experience from hearing from the students that we've worked with over the years is that shadowing varies dramatically by what you're allowed to see and by how much time the doctor has, how the doctor treats you. Sometimes you're just stuck in a corner and that's all you get. Sometimes the doctor will take you aside and give you information about the case that you're seeing or assign you homework. Sometimes, if you're lucky, that's what happens. And so that to me is sort of like a crapshoot whether you get that or not. But that's what interactive shadowing should look like. That is the best learning environment for sure. And that's something that you can guarantee during a virtual environment. All right, I see two more questions coming in. First, the second one says, do the HEAL courses cost money? They do have tuition. The HEAL 101 is free. It's our pledge to you guys to try to get you virtual shadowing during this difficult time. But then the courses themselves are intensive. We have instructors to pay. And so that's where the tuition goes. And then the third question is, are the virtual hours accepted by graduate and professional programs? So we actually conducted a survey of every med school in the United States about this. And the answer was broadly yes. Almost all of them said, look, it just depends on what you learn. If you just are watching videos on YouTube and calling that shadowing, that's not it. It's all about whether it's interactive and memorable and what you have to say about it. So that's what we design our courses at HEAL. And I don't think that's true of all the virtual experiences there. All right, okay. And then, the link, if you guys want the link to clinicalshadowing.com, I'll put that in the chat, in the box here too. All right, I'm gonna stick around. I don't want to take up the time though that my colleagues here have to talk. And so thank you guys for the invitation to come out. And I'm glad we could work around and get the right order to tonight's presentation.
Thank you guys for the questions. If you have questions for Rob, just make it specifically to Rob in the Q&A and he can answer it typing, okay? So up next is Itzel, who's here to present on the Care Extender program at UCLA. Go for it.
Hi, everyone. My name is Itzel, and I am the Public Relations Coordinator with the Care Extender program here at UCLA. I'm going to share my screen so I can show you my presentation. All right. All right, so this is the Care Extender program. We are located at Ronald Reagan UCLA Medical Center in Westwood, or you could choose to work at UCLA Medical Center Santa Monica. So this is a program introduction. I have worked both in Ronald Reagan and Santa Monica, and I have been part of the Care Extender program for 5 years. I absolutely love it. My favorite department was pediatrics, and I worked there for over a year. However, we have a lot more departments, but I'll talk about them a little later in the presentation. Also in this program, you will be able to gain professional development and take on leadership roles such as public relations coordinator like I am. One of my greatest achievements in the program was being Care Extender Staff Member of the Month. And these are just a little highlights of my time at the Care Extender program, but I'm going to go on and share further about our program. So our program is designed for pre-health students. This could be nursing students, health administration, pre-medicine, or BS degrees. Also, it could be for other students who want to work in the field of medicine. It could even be considered health law. Right now, I'm pursuing my Juris Doctorate in intellectual property and health law. So this just shows that the Care Extender program is a great program for all different kinds of medical backgrounds. So program requirements, you at least have to be 18 years old. You have to be currently enrolled, graduated from an accredited college or university. To be in our program, it is a minimum 1-year commitment. And within that 1 year, you complete 250 floor hours. There's 1 4-hour shift per week in the either Santa Monica or Ronald Reagan Hospital. When you become a Care Extender, you'll be able to put preference in which hospital you'd like to work at. So for example, in my first rotation, I was at Ronald Reagan, but in my third rotation, I wanted to try a different hospital. So I was able to work in the pediatrics unit in Santa Monica. And in your first rotation, you would be able to do a 1 2-hour bonus greeter shift, which is the first rotation only. So you'll be able to greet guests that come into the hospital, or you could work as an assistant to our program manager in the office. So you'd be able to decide which greeter shift you'd like to do. So I talked a little bit about this before. We have 2 locations, which is in Santa Monica, and we also have the Ronald Reagan Medical Center. So in the Santa Monica departments, we have many different departments, but these are just some of the program favorites that a lot of care centers like to be part of, which is family medicine, inpatient shadowing, orthopedic surgery center, critical care unit, physician shadowing, and many more. So in Ronald Reagan, it is the adult level 1 trauma center. So you'd be able to see a lot of hands-on shadowing experiences with the physicians and the nurses. Right now, the UCLA, Ronald Reagan, UCLA Health is ranked #1 in California and #4 in the nation, which is amazing. So like I said, with the Santa Monica departments, these are just a few of the Ronald Reagan departments, highlighted departments that a lot of care centers love to do, which is the emergency room, GONDA, medical intensive care unit, pediatrics, Eye Institute, and the neonatal intensive care unit. I actually was able to shadow the NICU, and it was one of the greatest experiences. I got to work alongside the medical students, the medical physicians, and the nurses, and really got to see hands-on the things that they do for these little strong babies. So these are some of the duties that you would do as a care extender. So you're definitely the frontline help to the staff in your specific department. So you would deliver and receive substances from and to the lab. You would assist nurses, care partners in moving patients around the hospital or around the unit. Be able to observe doctors' procedures, obtain/return equipment to and from the supply room, assist patients in any of their needs. For example, this may be playing with some of the children in the pediatrics unit. That was one of my highlights, being a care extender. Transport patients from one department to another. So you really get hands-on experiences, not only with the medical staff, but with the patients. And I felt that that was a huge highlight for me, was being able to help these patients one-on-one and be able to see such a huge impact that the care extender volunteers can be. So these are more duties, which is helping the department secretary. This may be with paperwork, answering phones, answering patient call lights, restocking the supplies around the department. We'd be able to sweep the newly discharged rooms and make sure that everything is there and ready for our next patients. And there's other various department specific duties. For example, if you're working in the NICU or the ICU or even in the ER, you're going to have very specific duties that you have to do depending on which unit you are working in. So a little bit about our application process. So you would attend an orientation, and at this orientation, you would be able to hear about our program on a deeper level, hear from alumni, hear from our current volunteers, and truly get a highlight of what it is to be a care extender. And at the end of this orientation, you would fill out an in-person application and you would turn it in. And then you would be notified if you were offered an interview. And their interview, it is kind of like the medical school interview. So it's multiple mini interviews. So you would meet with 4 or 5 of the current care extender staff members, and they would each ask you different questions. So it's kind of like a little speed round. And then if you're offered the position to be a care extender, you would attend a check-in day. And the check-in day is where it's just administrative. So you would bring in your background check, all your necessary forms, bring in proof of your vaccinations and all that kind of good stuff. But you would get all that information after you are given the position. So you don't necessarily have to have all the things done right now. You'll definitely have time between being offered the care extender position and before all your check-in day items are due. And once you've been fully cleared to start volunteering, you would attend a training day. And at this training day, it's a full day, and you'll be able to meet all the nurses and the physicians that are going to be working in your department. So you get to see a little preview of your department before you start volunteering, so you'll know exactly where to go on your first day. You'll learn more about the necessary training that is needed to be a care extender. And you'll get to meet all the other student volunteers, which is really amazing because some of you might end up working together if you're scheduled on the same day. So it's really great being able to get to meet your peers. And after training day, which is mandatory, you'll be able to start volunteering. At this time, due to COVID-19 and the regulations within the hospital, we're starting to bring back new care extenders. So as of right now, we are hoping to hold care extender application orientation sessions around February 2022, just to make sure that everything is set and ready to begin our program again. So this is also important information. You would be able to get letter of recommendation opportunities. This would be for graduate school, medical school, a job position, another volunteer position. You would be able to receive letter of recommendation from our program director. You also gain professional development. We have committee leadership that you'll be able to join committees and be able to work with the other staff members. For example, I have an amazing committee of care extenders that help me during every rotation. There's also program staff positions, which include like my role, or you'd be able to be the website coordinator. We have several different staff positions if you want to gain leadership. We have mentorship programs. And once you complete your 250 hours, you'd be able to receive a certificate, and having a certificate from the #1 ranked hospital in California and the #4 ranked hospital in the nation is a big, big achievement. So if you have any questions, this is our website, and this is the information for our program director, our program manager, and my information. And I will put in the chat where you could sign up. It's a Google form where you'll be able to put your name and email. And once our program is ready to start and we have orientation dates set, you would get an email from me or the program with all the necessary dates, where to sign up, and further information. So if anyone has any questions, I'd love to answer them at this time.
You have some questions in the Q&A, Tom.
Okay, awesome. All right, so I'm going to answer this first one. Is it competitive to successfully become a volunteer? It is very competitive to become a care extender. However, what we're looking for are students that really want to gain that patient relationship, patient experiences, people that show leadership skills and dedication and tenacity. When I became a care extender, I didn't have any medical background at all. I was just myself and spoke about everything that I wanted to learn and how this program can benefit me for the future. And I was able to successfully become a volunteer. So I would just focus on that when you're completing your application. So you do not need to be certified in CPR before applying. If you would like, then you would have to be the American Heart Association basic life support for healthcare workers. That's the only one that the care extender approves of. But you don't need to have it done beforehand. You don't have to worry about it. Once you become a care extender, there's usually bring someone from the American Heart Association for a couple days, and the students are able to do it with that representative. Do we get to choose what wing we work in and the hours we work? Okay, so you'd be able to choose the unit you'd like to work in each rotation. So you were to successfully complete the program, it is 4 rotations, and the 4 rotations are 250 hours. and you would have to work 4 hours a week to be on track. However, if you do have to reschedule, because let's say you have midterms, you'd be able to let your director know, and that's in your specific unit, and they would be able to reschedule you. So you just have to make up that 4 hours. So for example, if I had a big mentor coming up, I would just schedule 2 shifts within 1 week, which was 8 hours, but it was on a lighter load. And you get to choose, you get to every rotation, which is 3 months, you get to switch a unit, or you could stay in the unit if you'd like. You would just put your top 5 preferences, and usually you get your first or second. So like I said before, it is a little competitive, but however, since we have been on a hiatus due to COVID, our expectations might be a little different, but we'll see once we get all our applicants. It just depends on the number of applicants that we get, because we're only allowed to accept a certain number of applicants, but we always have students who reapply the following rotation and successfully get in. So just never quit, always keep going. So it is
I'm so sorry to interrupt you, but can you just type in the answers, because
Sure.
we are running a little bit behind time. And if we have some time at the end, we can revisit some of the questions, but hopefully you can type in most of your answers.
Yes, I have a lot of questions, so I'll type them all out.
Okay, thank you so much. June, you're up to present KGI's summer programs.
Hi, everybody. Good evening. So I'm June Kim. I'm the Senior Director of the Post-Bac programs and the Summer Pre-Health programs. So it's always good to be back to UCLA, my alma mater. So thank you for this time. So let me share with you what I want to talk about in terms of those of you that obviously are interested in the pre-health professions. So far, a lot of these programs are very much geared towards medicine. You are shadowing, you are volunteering. However, this program is a little different, and it depends on where you are in the journey to determine which of these programs might be a best fit for you. One of the things that, having worked with pre-health, pre-med students for as long as I have, is a lot of students want to know, what are they looking for, right? You ask yourself, what are the med schools looking for? Because if I know what that is, I'm going to do that. But for our programs, I want you to think a little differently. I want you to ask yourself, how do I know which specific health profession I want to pursue? Or said a little differently, how do I know I'm truly pre-med? How do I know I'm not pre-pharmacy? How do I know I'm not pre-dentistry? So our program is more like a Costco sample, meaning that it's going to be a program that's going to expose you to a lot of the different health professions. And that's why we came up with the title, Summer Explore Health Profession. It is a 2-week program. And the way it's broken down is, as you can read from the slide, you got programs, meaning specific institutions and their specific programs. And you'll see some sample list of what those are. Also different professions within the healthcare umbrella. And then you'll also get to hear from actual students, either in medical school or dental school and so forth. And of course, we have the classroom learning experience where we will engage in a lot of Socratic, interaction, a lot of conversation as opposed to a lecture. This program is limited to, if it's in person, it's going to be under 50, but we also have an online version, which means that there's going to be no limit. So as I had mentioned, the program spotlight, which I just realized we have the worst med school in California in this picture, my apologies. But we do visit different institutions, and we look at different types of health professions. So you can see we got everything from medical school all the way down to nursing. So we actually, if you are doing the in-person version, we get on a bus and we go and visit all of these different health professional programs. And these are not all at USC. Yeah, we would not do that. It's just for the medical school, we would go to USC School of Medicine. And I believe last year or the 2 years ago, we went to USC School of Dentistry. But a lot of the other health professions, we would attend different institutions. So in terms of the profession spotlight, last year, because of COVID, we were unable to set up clinical shadowing experiences for our students. So instead of shadowing, what they needed to do was listen to and engage in conversation with these different healthcare professionals. We had a dentist, we had a physician, we had a podiatrist, and you can see all the other types of healthcare professionals. So that was a 1 hour long online Zoom conversation with the various healthcare professionals. So our students will be exposed to the different healthcare professional programs, different healthcare professionals, and then of course, the different students who are in the different healthcare graduate programs. So again, here you have medical school, dental school, public health. We had someone who's in graduate school for public health. And one of the real benefits of doing something like this is it really helps you figure out why you want to do specifically med school. You will definitely be in a better position to talk about why you might have been able to eliminate why you don't want to do pharmacy. And sometimes the real difficult comes when you are being asked, have you ever thought about PA? Because you're thinking to yourself, no, physician assistant, no, I've only wanted to be a physician, not a physician assistant, but you might need to answer that question along the way. And plus, it's a great question to ask yourself for your own personal benefit. Very often, students are always trying to think from the programmatic side. Well, what questions are they going to ask me? What answers do they want to hear from me? And again, this program is designed to help all of you answer your own questions. So we got the program spotlight, we have the professional spotlight, we got the student spotlight, and then when it's in person, we actually do some fun things over the weekend because it is a 2-week program. So that Saturday that's squished in between, we will go check out Los Angeles. I know for all of you, going to Santa Monica Pier is nothing exciting because you're so close by, but you have to understand our program is a national program. We have students from all over the country. We have students who have come from North Carolina, Texas, South Carolina, Tennessee, and they get so excited going to Santa Monica Pier because for them also, you know, just being by the ocean is such a treat. So that is our Summer Explore Health Professions program. It is a combination of shadowing. Now, it's not hands-on experience because if that's what you're looking for, I think you've learned about 2 wonderful programs that's going to allow you to get hands-on experience. But again, some of you might not be quite, you might have already had some of that experience, but what you're really looking to do is refine sort of the messaging as you prepare to apply. Which brings me to our second and final summer program that we have available at KGI, which is known as the Application Bootcamp. And you can kind of figure out for yourself what that entails. It's hands-on assistance with your application. We have the luxury to do that. It is going to be limited to 20 students because you're going to be getting some immediate feedback on your personal statement, your extracurriculars, also which schools to apply to, which schools not to apply to. So this is a lot of intense advising and guidance. We will also work with our students on interview skills and techniques. We record all of those, and then students will get to watch themselves and see what they can improve upon. So learn by doing. And as you can see, I think we were doing a simulated mock admission exercise where they were pretending to be an admission committee. And so they were trying to figure out how this whole process works. So that is all I have for all of you tonight. Those are the 2 summer sort of pre-health summer programs that we have at KGI. Keck Graduate Institute is not part of USC. As soon as you hear the word Keck, I know you might have some aversive reaction, as I did too when I was an undergrad student there. But Keck Graduate Institute is one of the 7 colleges out in Claremont, California. Some of you might be more familiar with the undergrad campuses of Pomona College, Harvey Mudd, Scripps, Pitzer, and Claremont McKenna College. So All right, are there any questions for some of you who really don't know exactly which healthcare profession? I think our Explore program would be really, really helpful. We've had numerous students change their mind after participating, or even if you were pre-med and you participated, you now are even more confident that medicine is the path for you. Why? Because you've shadowed all these different healthcare professionals, and you know you don't want to be a dentist because they're working so closely inside of someone's mouth. You know you don't want to be a veterinarian because you know what? You are deadly afraid of dogs and animals. So that is our Summer Explore Health Profession and our application bootcamp. Thanks for the attention, you guys. Any questions? Let me click on here and say, all right. I knew I did a perfect job. No questions, Christina. It happens every time.
How can that be? All right, so if you guys think of any questions, please feel free to put it in the chat, either for Rob, June, or Ital. I see Ital is working steadily, answering all those questions. Good for you. So my fourth presenter did not come, but I really want to show their website at least. Unfortunately, I won't be able to replicate the spiel they usually give, which is very informative, but because I've always recommend this resource, I really want you guys to know about, so I'm just gonna quickly show the website. So UCLA Center of Pre-Hospital Care is at Gailey, so very close to campus, and they have a great selection of courses. EMT, paramedic, licensed phlebotomist, first care provider, and they have courses BLS, CPR, first aid. So you get to see all the courses on their website. I'm gonna put this website in your chat, and hopefully you will be able to get in touch with someone who can tell you a little bit about these courses, because I think that some of these options are great if you want to get certified in something to get hands-on experience, and while you get hands-on experience, you can get paid for it. So I'm so sorry that my presenter did not come, but here is the website I just showed you. And we have a little more time if you guys have any questions for any of the panelists. And I will also show you some upcoming events. So feel free to put the questions in the Q&A in the meantime, and have June, Rob, and Itzel answer some of your questions.
I am also a UCLA alumni, so if you have any questions, please let us know. We'd love to answer them.
Yeah, I'm not sure who this one is aimed at in the chat here, but it's saying, is becoming an EMT worth it? From a time investment to reward scenario feedback.
Okay, I'm gonna try, because that depends on what your availability to work is, because EMT is one of those things that you can do on weekends, weeknights. So a lot of students choose that option because there is a lot of flexibility. Again, there are a lot of downtime because thankfully not every minute somebody needs an EMT. However, if you are, on your shift, sometimes you get to shadow doctors in the ER or talk to nurses. Again, it's an opportunity to get some hands-on experience. You may want to talk to EMTs to see what the work load looks like, because I think that's the best way to figure out whether this is something that's good for you or not, and decide based on that.
Yeah, and just to add there, sometimes I hear from students that just have time to get the certificate, but not actually do the EMT work, and that is generally worthless. It doesn't help you to get certified unless you actually spend some time working as an EMT. So I wouldn't just pursue it for the certificate, only do it if you plan to actually be an EMT.
In fact, Rob, I would tack on there, it actually backfires. It actually hurts because what it conveys is a very poor judgment in the use of your time, that you would invest the time and energy to do that program, but then not actually do anything with it. So, you know, one of the things that I think students very struggle with, and it's very difficult because, again, the admission process seems so mysterious. You know, you have friends and people you know who have great stats, GPAs and MCATs and whatnot, and they don't get in. And then you have people with lower stats who get multiple acceptances. So it just sort of boggles the pre-med student's mind. And so one of the ways that I hope I can share with this sort of a process with all of you is they're looking for two things. They're trying to assess two things and two things. Number one, are you someone who's capable of handling the rigorous science curriculum? And how do you think they're going to assess that? Looking at your picture, looking at your social media? I mean, how do you think they're going to answer that? They're going to look at your academic metrics. They're going to look at your GPA. They're going to look at your trend of the GPA, because some of you might have a positive trend. Some of you guys might be going the other way, which is not good. And of course, the MCAT. So that's the first part. What's the second part they're looking for? This is where all this clinical experience becomes crucial. You could have a 4.0 from UCLA, which is pretty darn impressive. Especially as a science major, that was extremely, extremely difficult for me. So, and I didn't get a 4.0. So the second thing is that you need to demonstrate that you not only are capable of the rigorous science curriculum of medical school, pharmacy school, and so forth, you're also truly aware of what that profession entails and that you're going to stick it through and persist all the way through. So that's why you want that clinical experience. You want all these different sort of extracurricular and work experience. It's not because they're looking for that specific thing per se, right? So sometimes students feel like, well, I got to do research. Really? Who told you that? Well, my friend's roommate's mom, who's a doctor, said, you know, that's not how it works. There are some schools that look for that research, and then there are other programs that don't. So, you know, utilize your advisors, utilize, you know, people that, especially med schools that have a very, very welcoming, open advising policy. They will communicate with prospective students. So please don't do certain extracurricular activities because you think that's the key to getting in. Okay? All right, thank you.
Thank you for that. And we have another question. Was there a link for the KGI summer program? June, can you put in a link for us in the chat? Okay. Yes, there is a link. I hope everybody can see that. So while we are still waiting for question, let me see, I need to, hold on, because I'm supposed to have, there it is. Please help us figure out how good our programs are and help us get that feedback from you. And I promise we'll do our best to listen to your feedback and provide great resources for you in the future as well. So let's see, 13, awesome.
Did they get $1 off their next cup of coffee, Christina?
I wish I could do that. Maybe we can suggest some Amazon gift cards if everybody is responding. So we are at 57%. So please, please, please give us your feedback. We really, really appreciate it as we get back to in person. We need to know what you think and where you're at. What would you like to see? We are almost at 100. Let's go, guys. I need 6 more students. 5, 4. Let's do the countdown. I cannot drop a ball, but I can do the countdown. So 3, I need 3 more students. I guess. All right, 1 more. Come on, let's do 100. Yay, we made it. Thank you so much. So this is the results. Thank you so much. It was recorded, so thank you. And as a parting information, I'm gonna share the upcoming programming for pre-meds. So we still have some great things coming up. MCAT strategy sessions to learn about how to prepare for the MCAT. We offer an MCAT practice test every quarter, thanks to Princeton Review. Those of you who decide that maybe PA is best to go, GRE is coming up as well. Hidden gems in healthcare for those of you who are still exploring other options. And we do started a new series to highlight pre-health student organizations. On campus, we have 4 dates for the quarter. You can see the dates there. The times are always 1:30 to 2, and at each event, you're gonna be able to meet 3 pre-health student organization representatives to hear about all the great things that they do in their organization. So I hope to see you all at other events, and thank you so much for participating in this one and providing us your feedback. We really appreciate it. Thank you so much.
Thank you, Christina.